Hi, my name is Harsha Krishna. I am a PhD student from KTS Royal Institute of Technology, Sweden. I am from the Division of Health Informatics and Logistics. I just published a paper titled Issues in Identifying Strategies for Youth Well-being Promotion using participatory sessions and text mining in Swedish municipalities as a qualitative study in the online Journal of Health Informatics in JMIR. In Sweden, particularly in Stockholm, different municipalities have identified that preventative approach to mental well-being is one of the best strategies to ensure a high quality of life for future generations and also to keep the costs low for the healthcare system. However, there are different factors that affect well being, and it is usually difficult for a municipality alone to sort of look at various effects which are monitored by different departments in the municipality to define what well being is or to define what priorities have to be set in order to promote well being. So therefore, what we did was to use a data fusion technique to combine data sets from different parts of a department and various data sources. And then we used this data set to generate a number of data visualizations as different dashboards of data. And then we presented them in participatory workshops. Now, what this allowed stakeholders in the workshops to do was to discuss the data that was presented to them and also request various different kinds of data based on what their own experiences suggested them to do. For example, an educator would request data that would cross reference attendance with physical health, or to see if higher attendance meant a high level of mental health. What this allowed them to do was to use what they experience while working with the youth and have the discussion across various departments. So, our participatory sessions consisted of experts from different parts of the municipality, which is like physical education, pedagogy, with students themselves, as well as other administrative components and experts. What we did later was to analyze the transcripts of the interactions between the different people to understand what constituted higher priorities for different groups of people in these sessions based on text analysis. We were able to do this across different municipalities. What we were able to show was that based on the individual experiences within municipalities, the, there was a variation in the priorities that was assigned to what would constitute better well-being for within a given municipality. So we chose the JMIR online health informatics journal mainly because of three reasons. One being that it's a pretty good impact factor with a relatively old history of publications. The second was that this was one of the few journals that accepted cross disciplinary work of this nature. And finally, we were very interested in seeing very quick turnaround times for reviews, and we were very satisfied with the quick review process.